What's up, everybody? Khaled here from Insauga.com, and I have a special interview today. I have a friend that has a father that has COVID-19 that was in the Eatonville Care Centre that reported 25 deaths of COVID-19 just on Monday. So if you're joining us now, I'll be interviewing my friend that has a dad that is in Eatonville Care Centre that reported 25 deaths of COVID-19. So I'm just going to get Rehan on the call right now. There we go. Hey Rehan, how you doing?
Hey, good, Kyle. Thanks for having me.
Hey, no problem. So if you're just joining us right now, I'm here with Rehan Ahmad. Has a father that's in Eatonville Care Centre that has COVID-19. Eatonville Care reported 25 deaths of COVID-19 on Monday. Rehan, when did you find out your father had COVID-19?
It was a week ago, actually, yesterday. It's been, actually, yeah, 1 week ago yesterday, we found out that he tested positive for COVID-19.
How did they communicate that with you?
A doctor had called me and informed me that he was being swabbed for the disease. And then 2 days later, we got the call back with the positive results. So, yeah, they had called themselves, the doctor and the nurses from the home.
We were talking on Sunday, and you were saying that your dad was sick before and they didn't test him, correct?
Yeah, it was my assumption that they had tested him. He had a case of pneumonia, slight pneumonia, they said, 10 days leading up to the positive test. So they had messaged me and told me about the pneumonia. And at that time I had asked, of course, was it COVID-19? And they assured me that it wasn't. I should have dug deeper myself and asked had he actually been tested, but like I said, I just assumed that they did test for him, and they didn't at that time. It wasn't until about 10 days later, once his antibiotics had gone through, that they told me they tested and swabbed for him.
If you're just joining us right now, I'm talking to Rehan Ahmad. He has a father that's in Eatonville Care Centre that has COVID-19 now, and they just reported 25 deaths of COVID-19. What is management telling you now from the house?
So I haven't really talked to management too much. Every day, myself or my mother will try to call to speak to a nurse on duty. It's a little difficult. They are going through a lot, and of course, you know, staffing issues at the facility. So it's hard to get through to them most days. It normally takes us about 10 to 15 times for us to get through to talk to somebody. So the only communication we're having is with the nurses on duty. And from what they're telling me, luckily, like, my dad is in isolation. He is doing fine. He doesn't have a fever, and he hasn't had one for the last few days. His cough, while it's still present, it hasn't progressed to a point where we have to be worried. So management hasn't really actually contacted us. So we don't know exactly what further steps will be made. We just know what we've been hearing from the nurses.
Your father, you said he's in isolation. How long has he been isolated for?
So unfortunately, his roommate actually passed away. He was in a semi-private room, so he had one roommate. His roommate actually passed away about 3 weeks ago. I'm unclear about how his roommate passed away, if it was virus related or not. They can't really disclose that information at the home. So he has been in isolation, complete isolation, for about, I want to say, 3 or 4 weeks. But they had stopped doing a lot of, actually most of the residents were under isolation anyways, for about, I want to say, 4 weeks now. Stopped doing communal dining at that point. They had all the residents in isolation in their own room. Even outside visitors weren't allowed. I haven't seen until this, I had not seen my dad since March the 10th, I want to say. So it'd been about a month that he had been in isolation.
You mentioned that your dad's roommate passed away. You did some digging as far as to try to find out what he passed away from?
I did ask, of course, the nurses on duty and the workers on duty, but they're obligated not to tell. They can't disclose that information about how a specific resident had passed away. So as much as I was trying to push them on that, because I wanted to get some answers as how my dad actually contacted the virus. They
Yeah.
were unable to tell me the exact reason.
Okay. When you heard about the 25 deaths, what did you think?
So I got the news last night. My phone started blowing up yesterday evening. We had just spoken to the nurse a couple hours earlier. So the update with my dad was a positive update. So, I obviously am like very concerned, and I'm very scared for all the workers there and the residents there. But luckily my dad is actually seems to be in a good spot right now as far as his condition. So that news, as troubling as it was, didn't really shake me too much. I think it concerned a lot of my relatives and family members and friends who had read it more than it did actually myself or my mom. Just because we know, like I said, my dad's condition right now has been kind of stable. So it's really upsetting to hear as far as what everybody else is going through. I didn't realize there was that many cases. So, I mean, to have 49 families going through the same thing I'm going through, to have 25 people who have actually lost loved ones in the home. I can't even imagine what they're feeling. And even the workers there, like, I feel horrible for them. I know they're doing everything they can, man. This is more of like a staffing issue that comes from the government on down. So I know like they do care about their patients there, and they're doing everything they can. And I can only imagine how scary it is for them to be going through this.
Have you noticed Eatonville Care Centre doing things differently now, or the way they're communicating with you, or the way they're talking to you, or the way they're dealing with the families?
Again, I can only speak to my experience. It hasn't really changed in the last month. Like I said, they went into a bit of a lockdown a month ago, mid-March. So I'd like to think they're proactive about it. I don't know what exactly is going on behind the scenes as far as how much more strict they've been. Of course, with the virus getting through and spreading the way it did, it had to come from somewhere. And I'm sure those questions will be answered once this settles down a little bit. So I haven't really noticed too much of a change over the last few days as compared to what they were doing a month ago. And like I said, they've been under isolation, and my dad has been on pretty much lockdown for the last 3-4 weeks regardless.
So if you wanted to communicate with your father now or get an update about your father, how would you go through it right now? How would you get that?
So my dad has dementia and Alzheimer's, as you know, Khaled. So, picking up the phone and calling is not an option for me. He doesn't communicate anymore. So I can't like call him and ask him how is he feeling today or anything. So the only way we have communication is, like I said, us calling the nursing home pretty much daily, trying to get a hold of somebody. They're under the directive, from what I understand, they don't call us unless something bad is happening. And of course, we want a little bit more frequent updates than that. We're not waiting just to hear for the worst. I'm actually technically allowed to go see my dad now because of his condition. When I found out he tested positive, I went to see him for the first time in about a month. And I went on the next day also. Just wanted to actually like visually see how he's doing.
Yeah.
The thing is, it's a fine line we have to walk, right? Like every time I go in there, I'm basically exposing myself to the virus, and then I don't want to pass that on to my mother, who is also a senior, also. So it's a kind of a thin line. So I can go in and see him whenever I want, really, but I'm holding off to go see him unless things take a turn for the worse.
You heard Doug Ford talking about, an iron ring around, seniors living centers and things like that. Do you think, the provincial government is doing enough for these centers?
No, I can't answer that and say that they are, with the amount of outbreaks that they've had and incurred. Definitely, like, somewhere along the line, the ball's been dropped as far as protecting our seniors and our elders. I'm hoping now that they will do everything they can. What these people need is they need help. They need, and what I mean these people, I mean the staff. It's not the staff. They just need more nurses. They need more help. They are understaffed, and I feel for all of them because they're all trying their best to get through this. So I hope this has been an eye-opening thing for Doug Ford, and I hope he sends them the help that they need, because it is an urgent matter at these nursing homes. They definitely all need help.
Have you ever considered taking him home? from or taking him out of the
Yeah. So luckily I have a good circle of friends who are in the healthcare industry. I have a couple friends who are ER doctors, some friends who are nurses, and from talking to them, there's a couple things. First of all, no hospital is going to admit him unless his conditions worsen. And like I said, my dad, luckily, his conditions are okay. So that's really not even an option to push him to a hospital. But even saying that, from talking to my friends, it seems that, bringing him to a hospital, there's no increased level of care he's going to get there, really, unless we've decided to put him on a ventilator or anything like that, which, we've actually decided we're not going to go down that route if he does take a turn for the worse. So saying that, it doesn't really make sense to move him to a hospital. He's going to get as much care here at the nursing home as he would in the hospital. As well, we've been told that it is actually kind of risky to move him during this outbreak. So I think he's in the best place, as crazy as that sounds, in a home with 49 cases. He's actually in the best place he can be.
Okay. I guess, how's your father doing now?
Yeah, the latest update from last night, actually today, my mom heard from him, was the same. There's no fever, which is fantastic. His cough hasn't progressed to get any worse, which is really good. This is basically, I'd say, about day 8 for him, as far as being like a confirmed case of COVID. Probably has had it a little bit longer, but if this is day 8, then we're more than halfway there from him being in the clear and having this virus pass through him. Really, the only concern is that he's not eating, and he hasn't been eating for the last 4 days or so. They have him on an IV drip, which is keeping him hydrated. And again, from everything I've been told, that's sufficient and should be good. So he is doing well. Alhamdulillah. Inshallah, everything will go well, and he will fight this.
Rehan, thanks so much for doing this, man. Please give my best to your dad, man.
Will do. Thank you so much, buddy.
All right, take care.
Take care.